This is an important blood test referred to as glycated hemoglobin or A1C test that type 2 diabetics must get done every 3 to 6 months to find out how well their diabetes treatment plan is working overall. Your blood vessels carry, in addition to blood, red cells, white cells, platelets, micronutrients, including sugar as glucose from your digested carbs, among others. The normal fasting blood sugar in a non-diabetic is less than 100 milligrams per deciliter. That is about 5.5 millimoles per liter. Fasting levels between 100 to 125 milligrams per deciliter is considered pre-diabetic, and over 126, that is 7 millimoles per liter, you become a full-blown diabetic. In terms of the HbA1c test, a level of 6.5% or higher on two separate tests indicate that you have diabetes, and A1C between 5.7 and 6.4% indicates pre-diabetes. Sugar floating in your blood seems to get adhered to the red cells settling down in the hemoglobin molecule. Hemoglobin is a special protein containing amino acids, is a red pigment containing an atom of iron found in the red blood cells. When you get a recording on your glucometer by pricking your finger and testing a drop of blood on the strip, it estimates the blood sugar level at that moment. HbA1 test reveals an average blood sugar reading for about 3 months. This is because the lifespan of a red cell is approximately 3 months. When blood sugar level goes up, intake by the red cells also goes up, giving a higher HbA1c level. Isn't this a God-given test to keep your blood sugar level stable all the time? This test may not be accurate if you are anemic or lost red blood cells, or after blood transfusions, or your red cells lifespan is shortened to less than 3 months. The target level of the HbA1c level is 6.5% or below in non-diabetes. If you have diabetes, your doctor will want to keep the HbA1c level between 7% to 7.5%, which corresponds to a blood sugar level of about 150 to 170 milligrams per dl per liter. That would be approximately 8.3 millimoles per liter and 9 millimoles per liter respectively. Fasting blood sugar of 8.3 millimoles per liter will indicate pre-diabetic levels. In a non-diabetic person, the fasting blood sugar is about 100 milligrams per deciliter or 5.5 millimoles per liter. The reason why the blood sugar level is kept at pre-diabetic range is to prevent getting into hypoglycemic attack by having a lower HbA1c percentage. HbA1c stands for glycated hemoglobin or glycosylated hemoglobin. The rationale for this test is that when sugar floats in your blood after a meal, it gets attached to the hemoglobin pigment within the red cells in the bloodstream as mentioned earlier. This phenomenon is due to the process of glycation of the hemoglobin. The more the blood sugar in the bloodstream, more will get bound to the red cells, or the hemoglobin gets more glycated. Once the hemoglobin molecule gets glycated, it remains that way till the expiry of the red cell, which occurs approximately 3 months later. This test shows how well a person's diabetes is being controlled over time. Glycation means blood sugar getting bound to the hemoglobin in the red cells. Glycosylated hemoglobin is tested to monitor the long-term control of diabetes mellitus. The level of glycosylated hemoglobin is increased in the red cells of persons with poorly controlled diabetes mellitus. How can we bring down the HbA1c percentage within normal range? Lifestyle changes are necessary if you wish to normalize your blood sugar level. What happens in your body if the blood sugar level is not controlled? Consuming moderate amounts of specific types of sugar doubles the production of fat in the liver and lead to development of fatty liver disease and type 2 diabetes so prevalent among Sri Lankans. Liver plays a key role in the metabolism of sugar to provide energy for your day's activities. Fatty liver, due to consuming excess amounts of sugar, will affect the metabolic activities in the liver. Some sugars are naturally found in fruits and veggies. They do not harm your liver. It is the added sugar in processed foods we eat contain added sugar to foods and beverages to enhance their flavor or improve food appearances and texture. These added sugars ruin your liver, resulting in non-alcoholic fatty liver disease. Liver stores part of the sugar absorbed as glycogen from your digested carbs. When the blood sugar gets low due to poor intake from food, skipping meals, or in starvation, the liver supplements the blood with glucose. The mechanism for this action is by the pancreas secreting glucagon, instructing the liver to convert glycogen, making glucose available in the bloodstream. Overweight and obese people should be screened for diabetes from the age of 35, and such screening should be done regularly until 70 years. HbA1c blood test would be the simplest and definitive test to be carried out on these patients. Screening and earlier detection can help prevent prediabetes and diabetes from getting worse and leading to other health problems. Kidney disease and blindness are leading causes among diabetic patients in any country, mostly in the US, and early screening will prevent such complications. Diet-wise, there is no specific diabetes diet. You need to center your diet on plant-based foods with little meat and more fish. Avoid processed foods, refined carbs and sweets. Check on the carbs and sugar levels on the labels or on the foods you buy at the supermarket. Stick to low glycemic foods having low sugar content. Daily physical activity is most important, especially a 2-hour brisk walk. The reason for this is that the blood sugar is more utilized by the liver to produce energy, and your muscles will use more blood sugar to provide energy. Also, exercising daily lowers your insulin resistance, and you will be able to manage your diabetes without much effort. By increasing your number of steps in your daily walk, you are bound to normalize your HbA1c percentage in your blood with medication and proper nutritious diet. Hope this video talk was useful. Stay safe and goodbye for now.